Good morning.
Morning, Dan.
Good morning.
Good morning.
Good morning.
Good morning, Judge. Hey, girls. Did you ladies try to do the questions for chapter 13 in the back of the book as I assigned yesterday? Yes, ladies, that's either a yes or no answer or question.
Yes.
Okay. Did you have any issues with any of the questions?
Yes, a little, but I'm gonna read the explanation. I kind of
Okay.
understand it. So
Okay. So if I ask you these questions, are you going to be able to give me the explanation without looking at the answer?
maybe.
I guess that maybe means no. Okay.
Okay.
Oh, that's okay. I know that's okay. The questions for this chapter is not as straightforward as the question for most of your chapters that you've done so far. Okay. That's fine. So you can try yes, okay, see if you're able to, yes, okay. But not that many, so we can try to see if you're able to. Do that. Okay, let's see. Okay, go over these questions here. And be done by 10:15ish. All right. Sorry, boss. We'll just go to SOK page 504. And we will look at question 392. Now, which of the following will improve the system's temporal resolution? Okay, so that means it's okay, 5 or 4 options, but only it's okay if it's okay, one of 4 will lead to yes, okay, an improved temporal resolution. Clear? Now the first one says increased sector size. I just looked at this is going to yes, okay, increase the number of pulses per frame, which will increase the T frame, which will reduce the frame rate, which will degrade your temporal resolution. So that is not the case. It had improved the temporal resolution had it said decreasing this exercise, because then everything is okay, that increased is going to increase whatever increased, or decreased is going to increase. Increased line density. So that's okay. That increased line density as gain is going to just okay increase the number of pulses per frame, which will increase the T frame, which will reduce the frame rate and will degrade your temporal resolution. So that's not the case either. If you went and says, okay, whatever increased, decreased, and whatever decreased, increased, that will improve. Increased PRF. Now we can say, okay, an increased PRF mainly will mean that, okay, yes, that there will be okay, a reduced, sorry, PRP, which means it's okay, is indirectly saying it's okay, reduced number of pulses per frame, or time between pulse of a frame. Okay, so okay, we can say okay, reduced time between pulses. Which okay, mean yes, okay, we're also I mean that okay, yes, if you said this means okay, I mean that we have a reduced depth. So reduced depth is going to yes, okay, improve your temporal resolution. Increased frequency has nothing to do with your temporal resolution. So that is mean that's okay, just you can say it's okay, irrelevant here. Okay. Did that make sense? Question 393. And that's going to say, okay, true or false. An ultrasound system with longer pulse duration will generally have, okay, a better temporal resolution. Well, okay, that's false. We can even say it's okay. a pulse duration is, well, okay, yes, not relevant to the temporal resolution. You can still have, okay, as a short pulse duration and a good or bad temporal resolution. You can still have, okay, yes, a high or great pulse duration and have a good or bad temporal resolution. Okay, it's not going to be as okay the pulse duration that will affect, it will be as okay the number of pulses. Per frame that will determine whether you have a good resolution or whether you have a bad resolution. For a good resolution or for a good temporal resolution, it's okay, but mainly it's okay, need a low number of pulses per frame. That will give you, okay, a good temporal resolution. And it's mean it's okay, going to be okay, a great number of pulses per frame that will give you, okay, a bad temporal resolution. But not your pulse duration. Is that clear? Because your pulse duration and your temporal resolution is not what you can call it, related. Did that make sense?
Yeah.
Okay. So the main is okay, just want to say, okay, yes, do you know the difference between yes, okay, pulse duration and okay, yes, number of pulses per frame? Those are two different things. $394. Now the length of the funds does not directly yes, okay, influence the temporal resolution. Now when they say yes, okay, length of pulse. Clear? What that means is okay is pertaining to is going to be it's okay your spatial pulse length. Okay, but here it's okay say that that is not affecting the temporal resolution, and mainly because it says not affecting, that's what makes it true. Because your spatial pulse length, just like your pulse duration, is not related to your temporal resolution. Clear? What was going to be related was mainly as okay, what we just said in the previous question is the number of pulses per frame. Yeah. So this means okay, just asking the same thing, but in the previous question is okay, they didn't use the word not. So that was why it was false. Here it's okay to use the word not, and that's why it's okay. It becomes true. Because the length of your pulse or your spatial pulse length is not affecting the temporal resolution. Is that clear? This spatial pulse length here, ladies, what is that going to affect them? Your spatial pulse. Huh?
Resolution. The actual
Pardon?
resolution.
Exactly.
Isn't it
Very,
the actual resolution?
exactly. Very good. That will affect your axial resolution. Clear? Question number 395. Two imaging systems produce acoustic pulses. So we have two systems. We can just, okay, as a for simplicity, as okay, label them A and B. Yeah, okay. Now, what do they have? Yes, okay, one pulse is 0.4 microseconds long. So when it says, okay, one pulse is 0.4 microseconds long, that's going to be as, okay, your pulse duration. So 0.4 microseconds, and the other is going to just, okay, be 0.2 microseconds. Clear? Which is most likely to provide the best temporal resolution? Because this is the same question, just asked in a different way as we did in question number 393. This is all you got. Okay, where we can say is okay that this is okay as a shorter pulse duration. This is a longer pulse duration. No, sorry, opposite. Sorry. What the hell? And a shorter pulse duration. But that is not going to help us to determine which of these two is going to just, okay, give us, okay, as a good or bad temporal resolution. Mainly because, okay, your pulse duration is not related to your temporal resolution. It would have been a different question had they said that, okay, for instance, okay, number of frames, no, sorry, number of pulses per frame. And we had said, okay, yes, one had 4 and one had, for instance, 2. Then was going to be this one here, which would have the best temporal resolution. And this one here will have had a bad temporal resolution. Based on this, okay. But mainly because, okay, as you just said in question 393, that pulse duration is not related to your temporal resolution. So likewise is it that, okay, yes, your spatial pulse length is not related to your temporal resolution. Clear? So pretty much, okay, it's the same question just being asked in a different way. Or you can say the same concept being inquired about just in a different way. Now, which two factors determine the temporal resolution? And that's mainly as okay, just off your book. And what's going to be as okay, speed of sound in media or medium, which I mean it's okay will be as okay the tissue. And the other one was going to be the depth of field. Oh, that's okay. What also referred to as imaging depth. And this one here was what we yesterday said was okay as what the hell? This one here is okay, well, okay, as the, as you say yesterday, is the main limitation of temporal resolution. Why? We can't adjust it. Why? Because it's mainly it's okay determined by the medium. Okay. Pixel size. That's something that we'll talk about in chapter 14. Focal zone and sector depth. Okay. Okay. Focal zone, that's going to just okay, determine your lateral resolution. Sector depth, just another way of saying it's okay, imaging depth. Propagation speed and frame rate. Flip. Now, which two controls determines the system's temporal resolution? Now, when we say it's okay, control functions are called controls. All I mean, that mainly means it's okay, two things that will be it's okay, adjustable. The two things that were adjustable, which will control, yes, okay, your temporal resolution was imaging depth and the number of pulses per frame. Yeah. Imaging depth, that is controlled by the depth knob. The number of pulses could be controlled by as okay, three different things. You get a number of focal points, the sector size, and okay, yes, the line density. Yeah. So there actually are, yes, okay, functions on your system where you can, yes, okay, increase the number of focal or change the number of focal points. You can change the sector shape size, and you can, yes, okay, increase or decrease the line density, yes, okay, accordingly. Okay. But these were mainly as okay, you can say as okay, the two major controls that determines yes, okay, the temporal resolution. Did you girls get that?
Yes.
Good. Question 398. And again, yes, okay, we go and say yes, okay, true and false. So ultrasound system with a shorter pulse repetition period. Shorter PRP. What does that indirectly mean? Lesser depth. Okay, will have better temporal resolution than a system with a longer PRP. So that going to mainly mean that okay, this system here has a better temporal resolution than a system with a great PRP, which means is okay, indirectly is okay, or mean greater depth. Yes, this system here has a better temporal resolution. So that is true. Oh yes, okay. Practically out of these two here, okay, this one will have okay, worse or bad or degraded temporal resolution. So if they just flip it around and say, yes, okay, it is true to say that a system with a greater PRP has a poorer temporal resolution than a system with a lower PRP. That will still be true. Okay. Any questions? So that's okay. Indirectly, it's okay. What this PRP, I mean, it's okay. Just reference to is the depth or imaging depth or depth of view. Okay, but they didn't directly put the word depth in the question. I mean, it's okay. I just played with the PRP. But then you have to just, okay, know the relationship between these two. So they are directly proportional, okay? Show a PRP, which mainly is mean that, okay, it's the time between pulse 1 and pulse 2, pulse 2 and pulse 3, pulse 3 and pulse 4 is shorter. Whereas here, the duration between pulse 1 and pulse 2, pulse 2 and pulse 3, that duration is going to be longer because of a greater depth. Is that clear? What I mean that, okay, here you have a low G frame. You have a greater frame rate, and that greater frame rate leads to good, where here is opposite. It takes a greater time to create a frame, which means that you would have a lower frame rate, and the lower the frame rate, more temporal resolution. Okay, question 399. Now, what they mean to say here is, okay, what is the primary disadvantage of multiple focal zones along each scan line in a two-dimensional image? What they mean is, okay, it says, okay, what is the disadvantage of this, okay, focusing at multiple points along each scan line? In a two-dimensional, okay. Now, ladies, it can't be option A. Rather, why? Because option A says, okay, improved temporal resolution. The improved cannot be a disadvantage. So that's okay. That should be, that's okay. Straightforward right there. Clear? Okay. Then they go as, okay, decreased temporal resolution. Yes. First of all, because I said decreased. But yes, okay, you will have a decreased temporal resolution because you have a greater G frame. Why do we have a greater G frame? Because the beam first focuses at this depth. Then, for instance, okay, this depth. Then it focuses at this depth, then it focuses at this depth. So there's actually going to be, okay, an increased number of pulses per frame. Which mainly will mean greater G frame, lower frame rate, poor, or as I say, it's okay, decreased temporal resolution. Well, let's just look at the answer. Improved lateral resolution. Well, again, it's okay when it says improved. Okay, although it says, okay, lateral resolution. Well, first of all, it's okay, the question doesn't ask about lateral resolution. Oh, well, okay. You can say, okay, anything that is improved is not going to be at disadvantage. that would rather have been an advantage. So I had to say, okay, what is the advantage of multiple focal points in a two-dimensional image? That advantage would have been that you have a improved temporal lateral resolution. Yeah, so this actually is okay, becomes an advantage of multiple focal points. Improved longitudinal resolution. No, not really. Okay. Because what was your longitudinal resolution? What did we mean by longitudinal resolution? Or your longitudinal resolution can also be known as what?
Axial,
Axial resolution, also known as
range, radial, radical,
not radical, my dear,
radial,
radial, okay,
and depth.
and depth. Clear? Okay. But that was going to say it's okay, be improved by, it's okay, because it's okay, a shorter spatial pulse length. And or it's okay, indirectly, it's okay, a shorter pulse duration. So you can mean it as okay, the reason, okay, the way that you actually exclude was the one that said improved, because being improved is not a disadvantage. Okay. Yeah, okay, option C would have been, it's okay. A correct answer had to ask, okay, what is the advantage of having multiple focal points? That mean okay, you have a good lateral resolution here, you have a good lateral resolution at this depth, you also have a good lateral resolution at this depth and at this depth. Yes. Question number 400. What is the primary advantage of multiple focal points along each scan line? Well, I already answered that one, right? Okay. That's an improved lateral resolution. Clear? Okay, so that's okay. Unknown, yes, okay, I answered. Okay, that question. 401. Yeah. Which choice will result in an increased frame rate and temporal resolution? So maybe that's okay, what will lead to an increased frame rate and an increased frame rate? That's okay, we already know it. It's okay, yes, okay, lead to yes, okay, an increased, or because it's okay, an improved temporal resolution. Now, decreased propagation speed. Now goes at decreased propagation speed. Actually, that's okay, will lead to, yes, okay, we can say it's an increased T frame. And that will lead to, yes, okay, a decreased frame rate, which will lead to a degraded temporal resolution. So that's not the answer. That is at increased propagation speed. Then everything would have been upside down. Yep. Now, does a decreased sector size that means it's okay, leads to, it's okay, a reduced T-frame, mainly as okay, indirectly as okay, due to as okay, increased or decreased number of pulses per frame. And that decreased T-frame reached to as okay, an increased frame rate, as we have here, but will lead to as okay, an improved temporal resolution, as we have here. So that's most likely as okay, we can say at least the answer that we come across right now. Decreased lateral resolution. Right, okay. No, not really. Decreased pulse repetition frequency. Not really either, because a decreased pulse repetition frequency indirectly means greater depth. And that greater depth is going to as okay, lead to an increased T frame, which will become a decreased frame rate, which will mean okay, as a poor temporal resolution. But as I said, the opposite way, or meaning that you have a lesser depth. And then we had a reduced T frame, a greater frame rate, and improved temporal resolution. So the only one that made sense was lesser sector size. It could even say it's okay, lesser line density. And okay, the equation would have been the same. Did that make sense? Did you guys get that?
Yes, you got it.
Okay, you did. Okay, question number 402. Again, yes, okay, we are looking at, is this true or false? So sector scanning, okay, yes, with sector scanning, images with a greater detail, spatial resolutions are created when the number of acoustic pulses per degree sector is increased. That is true. Whatever sector shape or sector size you have. What they mainly say here is, okay, well, it could be any shape of image, even if you have, okay, as an image like this, okay, or shape like this, or image shape like this, or this, or this. Or this. It doesn't really matter. Okay, so it could be any as okay image shape. So don't get thrown out by okay at the sector scanning word. Because the main thing that they're asking is images with greater detail. Now what they mean is okay, mean by greater detail is okay as greater spatial resolution. Clear? Are created when the number of acoustic pulses per degree of sector is increased. Which mean do a higher line density. Does that lead to, yes, okay, better spatial resolution? Or what we in this case I can call it, okay, referred to as okay as exit resolution. That is true. Mainly because okay, what we have is a pulse goes like this and come back. goes like this and come back, goes like this and come back. And we says, okay, if we have a greater density of the pulses compared to as okay, we had okay as the same sector shape image or any shaped image by as okay with a lesser number of pulses. Now in the blue instance, as okay, what we will have is a lower pulse or lower line density. Now that may give us okay as a better temporal resolution, but that will actually lead to as okay a degraded spatial resolution and or as okay exit resolution. Clear? Further details about this here is going to as okay be discussed in chapter 15. So for now, just remember, okay, as greater number of pulses per degree angle means okay will increase as okay your length, line density. So higher line density is okay will give you as okay a better spatial resolution, and vice versa. Yeah. Any questions? Any question, ladies?
No,
Question 4.3 now. Ultrasound system with a 4 megahertz transducer. So that means okay, that's going to be the frequency. We can say okay, frequency of the transducer is 4 megahertz. Is used to yes, okay. Is used to image structures at as deep as 15 centimeters. So we can say okay. Depth of image. Here is going to say okay, be 15 centimeters. That makes sense. Now the next thing that I say, 20 images are produced per second, or are produced each second. What does that mean? 20 images are produced in each second. That is mean yes, okay, just giving you yes, okay, the frame rate. Where we can say okay, 20 per second. Did that make sense? Each requiring yes, okay, 100 acoustic pulses. So it can mean okay, that's going to be okay, it's like a pulses per frame is equal to 100 pulses. What is the PRF of the system? So the main is okay, asking us okay, what is the PRF? And what did you say PRF was? That's going to be okay, the number of pulses repeated per second. Now we had a similar question here. And to get that, we mainly is okay, just multiply the number of pulses per frame, which was 100, is being multiplied by the frame rate, which is going to be okay, the number of frames per second. And that will mainly tell us as okay, how many pulses do we have in a second? because each pulse had, or each frame had 100 pulses. And 100 frames were, 20 frames were repeated in a second. So yes, okay, you actually have, okay, yes, a PRF, which is going to be equal to 2000. Now we can say, okay, that's going to be 2000 pulses per second. Or we can say, okay, the PRF is going to be as, okay, 2000 hertz. Did that make sense? Did that make sense?
Yes.
Clear? Okay. Question 404. Which of the following sector imaging system will produce images or will have best image detail if all parameters are identical? Now go, what they mean is, okay, it's asking about is, okay, best imaging detail. Which means we can, okay, say mean is, will be as, okay, a better axial and, or as, okay, or we can say, okay, will be a spatial resolution. Now mainly as, okay, what we need for this is going to be as, okay, grade line density. Yep, okay. Now in option A, what do we have? Yes, okay, this says, okay, we have a 90-degree angle with 100 pulses per image. Clear? We have, for instance, okay, an 80-degree sector with 40 pulses. Here's actually going to be, okay, be, because that's okay, half pulse per degree angle. Because the line density is lesser, as half the number of, or half the angle. We go to C, a 70 sector, or 70-degree sector. And we have, okay, as a total of 84 pulses. Now to get that, you may as, okay, we'll just have to divide 84 by 70. So you get approximately, okay, 1.2. And in D as in dog is, okay, as a 0, as a 60-degree sector with 60 pulses. So here, okay, you can mean that, okay, your line density is 1 pulse per degree angle. So it's actually here that, okay, yes, roughly speaking, you have a greater line density, which will give you a better exit resolution. Did that make sense?
Yes.
405. Of the following, which imaging modality has the poorest temporal resolution? Now, when they say imaging modality, mainly is okay what we had talked about so far. Okay. Now, two-dimensional and real time. Well, that's actually going to be the one that will have, okay, as the best temporal resolution. A mode is irrelevant to, yes, okay, your temporal resolution. Color flow imaging. Now, goals, color flow imaging, that's something that we talk more about, okay, that's in chapter 19 and 20. Or what that actually is, okay, what it requires are going to is, okay, be yes, okay, a greater number of pulses. Or we can say it's okay, more correctly, it's okay, more data to be processed. And you can say more data to be processed to give you, yes, okay, the color Doppler. Takes more time. So due to, yes, okay, this more time, that's why you will have the poorest temporal resolution. In M mode, yes, okay, you do not have a poor temporal resolution. The whole point of, okay, is having M mode is to give you, yes, okay, the best temporal resolution. Did that make sense? Did that make sense?
You said M mode does what?
M mode, the whole point of having an M mode is to give you, yes, okay, the best temporal resolution. Do you remember what M mode was?
The motion mode.
Okay, good. Right, okay. So the whole point of, okay, yes, developing is, okay, the M mode was to give you the best temporal resolution, right? Because when was it that we used temporal resolution? I'll try to strive for as, okay, a good or best temporal resolution. If you're scanning a structure that is moving. What do we mean by moving? Either changing its position or changing its shape, right?
Yeah.
Good. So that's pretty much okay as what they just asked in question 406. Just the opposite. Which ultrasound imaging modality? Now, this is actually as I go to chapter 8, but anyway, chapter 11, has the best temporal resolution. And goals that is going to be as okay, your M mode. Clear? B mode goes was mean yes, okay. Now what was B mode?
Brightness.
Okay. Or because yes, okay, any basic ultrasound scan is B mode. Now some of you will take yes, okay, be scratching your head and say, what the hell is the duplex? While it goes again, yes, okay, something that we'll talk about in chapter 19. Clear, will be duplex. We can have color duplex, we can have spectral duplex. Okay, but again, yes, okay, you can say, yes, okay, more data. Color flow imaging. Well, okay, what we mean is, okay, just call color flow in the previous question as well. I mean, it's okay, it requires more data to be processed to give us, okay, the color imaging. Though it's okay, that more data takes more time. So it's okay, anything that takes more time is going to be with some poor resolution. Did that make sense?
Yes.
So the whole point of, okay, as creating M mode was mean is, okay, because you want to get, that's okay, the best temporal resolution. How did we get that? Mainly because, okay, R says, okay, whatever structure you're scanning. That means, okay, change in span of time. Your M mode just used one pulse. To me, it's okay, record the movement over time. In this section. But if you wanted to, yes, okay, you can move that pulse around. And say, like, I want to check the movement here. I want to check the movement here. I want to check, let's say it's okay, the movement here. Okay. Whereas, okay, as your B mode, or this image that you get, is made as okay, going to be as okay, be produced by all the pulses that produce as okay, will travel. And we can say, okay, the greater the line density of these pulses is okay, or the blue lines here is going to just okay, give you a better exit resolution. Or when you say okay, it's only going to just okay, one of these pulses here that will be just okay, used to give you the M mode, which will be as okay, this graph of okay, as the moving structures. Question 407. All of the following reduces your temporal resolution by increasing the number of pulses per image except from. Now what the mean is says, okay, all of the options here is okay, will reduce the temporal resolution. How? By increasing the number of pulses. per frame. Except from. So we may as okay, may actually as okay, have to look for the one that may say, yes, okay, reduce your temporal resolution. By yes, okay, with that, the grading of your temporal resolution is not going to be as okay due to the increased number of pulses. Now the answer is okay if you know it's okay, what were the 2 or 3 mechanisms that caused your temporal resolution to degrade by increasing the number of pulses per frame was multifocal, increased sector size, and increased line density. So anyone which doesn't match these will be the answer. So option A says what? Increased number of focus. Well, okay, that's the one. Which will reduce just okay your temporal resolution and by increasing the number of pulses. So that doesn't fall into the category of except. Increasing the line density. Well, okay, that increasing of the line density. Sorry. Where it's okay, reduce your temporal resolution by again, it's okay by increasing it's okay the number of pulses per frame. So that as well doesn't fall under the category of except. Increasing yes, okay, the view of field. Okay, increasing the view of field. Now, girls, that is just okay as view of field. That was okay, just another name for your sector size. Clear? So please make sure that you understand it's okay. We can say it's okay. Depth of field or depth of image, or what we can call is okay, imaging depth versus view of field, or is okay, view of image. Right. Which for me is okay, B is okay, another word for your sector size. So increasing sector size is going to just okay, increase the number of pulses, which is going to just okay, degrade the temporal resolution. Increasing depth of field. Now, girls, increasing depth of field is okay. That will reduce your temporal resolution. But that increasing of depth of field is not going to degrade the temporal resolution by increasing the number of pulses. Clear? Rather, yes, okay, just going to okay, degrade the temporal resolution by increasing the PRP, which means okay, just will reduce the PRF. Or we can say this increasing the PRP means okay, we'll just increase the G frame, reduce the frame rate, and so on. And okay, they're reducing the frame rate, but still reaches okay, degraded temporal resolution. But that is not due to just okay, an increased number of pulses. Did that make sense? So at first, yes, okay, you may be looking and say, okay, all of these options here is okay, degraded the temporal resolution. But there was only one which did not do so by increasing the number of pulses, and that was the depth of field or imaging depth. Clear? But you may, that's okay, still say, okay, if you know, that's okay. That, but it's okay that you don't know that, okay, field of view was that's another name for your sector type or sector size. You may end up, it's okay, choosing the wrong answer. Did that make sense? So yes, okay, those also known as vectors are important. Clear? Okay. That's one of the points that, okay, as most girls find, or not most students, like girls, most students find difficult when they go to the boards, because, okay, it's not always going to be as, okay, it's just axial resolution or lateral resolution. They may use radial resolution, and if you don't know what a radial resolution is, you are LOSG. Question number 408. Now, a sonographer is, okay, reduce the sector size from 90 degrees to 30 degrees. So what do we have? Okay, we can say, so we have a gray sector size, which is 90 degree, and okay, what he or she does is reduces the sector size to 30 degrees. Okay, we can say, okay, it's reduced to 1/3. Maybe that becomes relevant. The frame rate, however, does not change. So again, it's okay. Mainly it's okay questions that we have had in our chapter review as well. But they mainly say it's okay that, okay, although it's okay decreasing the size of the sector, the frame rate remains the same, which mainly means, okay, here, the chief frame of this would have been the same as the chief frame of this. Now, girls, what would normally have happened if we reduce the sector size? Normally, that's okay, what would have happened was that, okay, yes, the chief frame would have reduced, which means, okay, normally what I cause that, okay, as the frame rate would have increased. Clear? Okay. Normally, that's okay, what would have happened was, okay, that we will have had, okay, yes, what they mainly say is, okay, here, it remains the same. So, okay, yes, what else would have happened? Now, the cheat to look here is, you mainly is, okay, just have to, okay, look, anything that opposes this, that normally would have happened. That will be the thing that, okay, has also occurred as, okay, as the sector size was reduced, to mean it's, okay, cause the frame rate to remain the same. So any option that does not match these here will be the right answer. So what do we have? The imaging depth is decreased. Now goes, that is wrong. Because, okay, what would have been the effect that, okay, if you also decrease the imaging depth, that says, okay, right here was 10 centimeters, we reduced it to 5 centimeters. In that case, okay, the frame rate had increased even further because of an even reduced C-frame. Did that make sense? So that's not the right answer. Okay, the pulse duration is increased. Now, girls, we said as a matter of, okay, the first questions in this exam review here, that pulse duration was not related to your temporal resolution. Which means, okay, just makes it not related to the frame rate or chief frame for that matter of fact. Clear. So mainly because, okay, pulse duration is not related to any of these. While, okay, increasing it, decreasing it doesn't really make any effect. Did that make sense?
Yes.
Good. Multi-focus was turned on. Now, what multi-focus may do is, well, okay, yes. That will, yes, okay. Increase the C-frame and reduce the frame rate. So maybe multi-focus says, okay, is the answer. Who knows? But at least, okay, it matches, okay, as what our requirement was. That does the opposite of, okay, what normally would have happened when we reduce the sector size. The PRF is increased. Now, girls, when we say PRF is increased, increase of PRF mainly would mean that there would have been, okay, a decrease in PRP, which mainly would have mean that, okay, there would have been a decrease in depth, which is pretty much, okay, as the same as option A. So option A and option D, yes, okay, is the same, just in different words. It comes out to the same, okay? Okay, and option B could not be the answer because that means, yes, okay, just made it even worse. Or we can say, okay, the frame rate will become even higher because of a further reduction in the C-frame. So the only thing that, okay, so could have happened was that, okay, yes, we made as, okay, focus at more points here than we did over here. If that makes sense. Okay, but that's pretty much, okay, you can say, okay, the trick. How you, yes, okay, find the answers, yes, okay, this kind of questions here. Anything about chapter 13 that you still are confused about? No? Okay, ladies, just take a breather. And when we come back, we will start off with chapter dozen. Or chapter 1 dozen. Clear? So I see you ladies, should we say around 10:35? Okay. Okay, ladies. Welcome back. Okay, so let's see if we can get started off with chapter number 12. And although, yes, okay, the name of this chapter here is, okay, yes, 2D imaging, right? Okay. Or two-dimensional imaging. But what this chapter here mostly is about is mainly as, okay, we can assess, okay, it's going to be the different types of transducers. Clear? Later on, ladies, we will also talk about, okay, as another kind of, okay, a spatial resolution, which will be the elevational resolution. And in that, it's okay, we will even talk about, okay, things such as not just 2D, but 3D imaging. And or something that's going to be called 4D imaging. And then there's going to be as, okay, mainly as, okay, just other topics. And the main other topic is mainly as, okay, going to be as, okay, what we'll call loops. And okay, let me check the loops. That's okay. How to get rid of them. Because loops is a pain. But the main topic of this chapter here is going to be as, okay, the different types of transducers. Okay. Now goes, first of all, to create a 2D imaging. Okay, we are coming across two main challenges. In creating 2D images. The first challenge is that sound waves travel in straight lines. So if we say that, okay, we had, for instance, okay, if we have had a source, or we can do it this way. We can say, okay, we had a source that produced sound waves. These sound waves here, okay, would have been traveling in straight lines. What does that mean? that mainly mean that, okay, as this image as okay was going to lead to something that will be as okay unfocused. Okay, so we would not have had a focused image. So one challenge that we actually is okay, or what we actually is like would need to do is to me is okay, cause these sound line waves here not to travel in straight lines. Which may mean that okay, yes, for them to is okay. Refract. Because okay, when they don't travel in straight lines, it's okay, they will be able to focus. Yeah. And that was mean is okay, just the next challenge. Okay, that we will need the sound beam. That's actually okay what it comes down to reach its narrowest point. And that narrowest point that was going to be okay, what we call the focal point. Yeah. What happened at this focal point was, well, okay, because it's okay, that's where we have the best lateral resolution. Due to is okay, the narrowest diameter of the beam. Okay, but please keep in mind here goes, it's going to be as okay, the side to side dimension of the beam that will determine the lateral resolution. That top to bottom dimension of the beam. That's going to is okay, determine what we'll talk about later on, which is going to be as okay, your elevation resolution. Okay, I mean, yes, okay, to understand the difference between, yes, okay, lateral resolution versus, yes, okay, elevational resolution. That's why it's okay, you will see that, okay, as we go to, yes, okay, and talk about different kind of transducers. One thing that we will be talking about, or it's me, yes, okay, is going to be, yes, okay, the first point that we will talk about is going to be, as okay, the shape of the PCT, which in this chapter here is okay, mainly as okay, we're referred to as either as the crystal or as okay, the active element. But the shape of the PCT is going to, yes, okay, play an important role in determining, yes, okay, the dimensions of the beam at any point, but most relevant, yes, okay, at the focal point. Did that make sense? So the shape. So we're going to talk about, yes, okay, PCTs or crystals or active elements, which are going to, yes, okay, be in different shapes. In chapter 9, as we did, or as we said, well, okay, yes, the shape of your PCT. Well, first of all, it says, okay, we only got, or we mean is, okay, just talking about one single PCT. And that was going to be, as okay, which was disc shaped. And that's why we say, okay, we took, okay, as a dimension of the beam at this point here. So, okay, we'll say, this is what the beam looks like. Or even yes, okay, here, this is what the beam looks like. Clear? Okay. Okay, yes, at this point, yes, okay, it's just going to have a bigger diameter. But if you change the shape of the PCT to something else than a disk, that's going to, okay, affect the shape of the beam. Or we can say, okay, the dimensions, the height and the width. Did that make sense?
Yes.
Clear? Now, ladies, before going to yes, okay, into the specific details of any transducer, or yes, okay, the different kinds of transducers. A general concept of okay, as how a transducer works. We can take as okay, a transducer of any shape or whatever. Or size or so. That's probably a little bit too big. That's what it should become. Now, what your transducer will have, at least that's okay, most of our transducers will have, are going to be as okay. So let's we can say it's okay, groups of PCTs. Or it's okay, multiple PCTs. Now, ladies, the way that it works, but it happens so rapidly that okay, as the eye actually it's okay, it doesn't detect it as such. So it's okay, a fraction of okay, as microseconds or nanoseconds. But what a PCT or what a transducer may do is first this one here, or this PCT here, sends out a pulse that goes to a certain depth and then returns. Then that may be followed by this second PCT firing. Then followed by us, okay, this PCT firing, receiving. Followed by, let's say it's okay, this PCT firing and then receiving. Then followed by this PCT firing and then receiving. Then followed by this PCT firing and receiving. And yes, okay, go. That means it's okay, it just happens for each PCT or active element. Did that make sense? Now, in this instance, okay, that we said, okay, this here was the first to fire. And this one over here, okay, was the last. That mainly means that, okay, then the next cycle starts. It's going to start by, yes, okay, this PCT over here. Firing again. Followed by this, 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 followed by this. And we connect here. That's going to be okay. It's going to be firing as okay in a form of a pulse. So it's okay when it fires, actually, it's okay, it sends out a pulse. And what we mainly can say is okay is that the time span between the firing of this PCT to this, the blue to the green to the orange to the green, the green, light green to the dark green, the light dark green to the black, and so on and so. that mean it's okay, be determined by it's okay, your PRP. Did that make sense? What is going to just okay determine that PRP? That's all going to be dependent upon is okay, how great of a distance is it that okay the pulse will have to travel before it's okay returning back. Did that make sense? But the main thing to us, okay, just remember for now is that okay, yes, that if this PCT here is okay was the first, and this one here, for instance, okay, was the last to fire. That's going to be yes, okay, how it goes. So yes, okay, goes one cycle, then starts from here again. Yes, okay, a second cycle, a third cycle. Did that make sense? Or we can at least say that, okay, yes. Just give me a second, guys. Sorry, girls. Did that make sense? So that's me as okay, that's going to be as okay, a cycle that's going to be as okay, repeated and repeated and repeated and repeated and repeated over and over and over again. Yeah, okay. So yes, okay, this PRP or actually has okay has increased. Have we had a great depth of image? Or yes, okay, it had been a low PRP? Have we had a shallow depth of the image? Right, okay. There's just going to be as okay the opposites for your PRP. Did that make sense? Clear? But for most of our transducer, we will actually see that okay, yes, it's not going to be just one PCC, but it's going to be as okay multiple PCCs or crystals. Or since it may be as okay multiple, yes, okay, that will come with our number. How many PCCs do you have per transducer? It may range. Clear? But most transducers, okay, they're going to be lined up side by side like that. But when we say it's okay, that one PCT fires what it does, that sends out a pulse. of sound waves. Now those sound waves, that's okay. Well, let's say it's okay, this is the shape of a beam. All dependent upon is okay, our focal points. Where did we focus at? Now, for most of our transducers here, it's okay, we will be able to, yes, okay, adjust where we want to focus at. Not just at one point, but at multiple points. Okay. Did that make sense? So that's what we call as okay. Multiple focal points, or we actually refer to as that kind of transducers as being as okay array transducers. How do these array transducers okay? Or how is it that they're going to be able to focus at multiple points? It's electronically. So it's going to be okay, meaning the electronics of the system that will okay as fire in a way that okay as the beam can focus at this depth. Then it goes to this depth, then it goes to this depth, then it goes to this depth. But actually it's okay, enables us to focus at multiple depths using one single transducer at the same time, pretty much. Because this electronic says, okay, works so rapidly, it's okay that our eyes is not going to, it's okay, realize that, okay, what we actually are looking at is made up of, okay, as multiple frames. Is that clear? Okay, so yes, they are mainly as okay, there's going to be 5 points that we will talk about for each transducer. Okay, so 5 points are going to as okay be repeated again and again and again and again for each transducer. First is going to be the number of PCTs, or what we call crystals. Clear? Now with the number is okay, is also going to is okay, what's going to be the shape of the PCTs. Where those shapes were where that was one PCT or more than one PCT. Now, another factor is going to is okay, what's going to be the shape of the PCT. And it's okay, since we as okay, I've talked about that, we will made as okay, just briefly also say it's okay. How is it that they are arranged? Especially that's okay if it is more than one PCT. How is it that they are arranged in the transducer? Did that make sense?
I have a question.
Yeah.
Before you go on. So, how are they arranged? Is that only for the multiple PCT or that could be for one?
No, only if it's more.
Okay.
Because if it's one there, so okay, well, okay, this is the transducer, this is the PCT, that's it. So when it says okay, arranged, that's going to say okay, arranged in relation to one another. Did that make sense?
Yes.
Clear? Just think of it. If you are the only student in the class, you walk into the classroom and then maybe it's okay, you can say 5 tables and chairs, right? And I say, well, okay, you know what, dear? Just sit wherever you want to. Did that make sense? Most likely they will say, well, okay, there's only going to be 1 student, so we're only going to put 1 chair and 1 desk in the classroom for the student. Now we can say it's okay. It's not just 1 student, it's okay. Here we are talking of, okay, 14 students. Clear? Now maybe it's okay because it's okay due to it's okay the way that the classroom is arranged or okay shaped. There was no other way of doing it, but maybe it's okay, just arrange it in okay as rows. Okay, but having said okay, had the class been smaller, let's say it's okay, the size of the class being smaller, or the size of the classroom being bigger. You could have played a little around with the arrangement, right? Okay, we said, okay, it's boring to be seated in, okay, as in a row. Where the student behind is me, is okay, just going to look at the back of the head of the student in front of her. So what could be another way of arranging it? A half circle. Clear? Did that make sense? But that's only going to just okay be relevant if you have more than 1 chair or 1 student. That we can say, okay, now we can play a little around. That's okay. How is it that okay, as chair to chair and desk to desk is going to just okay be arranged? Is it going to be as okay in a straight line, or is it going to just okay be in a circle or triangle, or as okay a star shape, you name it. Clear? Okay, so you have more than 1 PCT, that's okay. How is it that they are arranged in relation to one another? Did that make sense? Right, okay. So that's yes, okay, main, that's okay, point number 1 that we will be talking about for yes, okay, each transducer. How many PCTs or crystals that this transducer have? And what is the shape of this PCT? And this shape of the PCT goal, that's going to become yes, okay, very, very important. Especially as okay later on, because okay, we will mainly end up okay as referring to as okay this dimensions of the beams. But where the beam also could be as okay like this. That we mainly say as okay, the width of the PCT, and okay, yes, the height of the PCT, There you can see as okay here. The width and height are not the same. Whereas here you can say, okay, roughly speaking, it's okay, the width is the same as the height. So it's okay, the shape of the PCT, although some of you say, what the hell? But it's okay, it will have an importance. Did that make sense? The other factor that we may talk about is okay for each transducer is going to be okay, or is the shape of the image that transducer is okay will produce. Now, ladies, there's going to be okay different okay mechanisms behind that. So as we talk about okay the shape of the image, we actually okay also refer to as okay the mechanism behind it. How is it that this transducer actually okay makes that shape image? Now, in a couple of the previous question, yes, okay, you might have heard of, okay, as sector. So a common shape of image is going to be, yes, okay, this sector shape, which means, yes, okay, just resembles, yes, okay, we can say, yes, okay, a slice of pizza. Or those of you who don't like pizzas, yes, okay, then you can say a slice of cake. And if you don't like cake or don't like pizza, then, well, okay. I don't know what to tell you. Clear? Now, the next thing, our next 2 points is going to just, okay, be related to the beam. Now, one is going to be, yes, okay, what we'll call, yes, okay, beam steering. Clear? Okay, now just keep, yes, okay, that, okay, this image here, yes, okay, was produced, yes, okay, by multiple pulses, which is, okay, forms beams. Although, yes, okay, your transducer physically, yes, okay, will be up here. But the question then arises, yes, okay, how is it that, okay, physically, yes, okay, the transducer is up here, but how will be able to, yes, okay, send a beam in this direction? How will be able to send a beam in this direction, in this direction, in this direction, in this direction, in this direction? That change of direction in which the beam is being directed is going to be often called beam steering. Did that make sense? So how is that going to, yes, okay, be happening? Or we can say, okay, mainly as, okay, one of the mechanisms by which, okay, as the image get the shape that it get is due to, yes, okay, the steering of the beam. The way that the beam is being steered. Is that clear? And why do they call it steering of the beam or beam steering? Mainly because it's the same that, okay, happens when you steer the steering wheel of your car. What happens when you turn your steering wheel in the car right? Your car is going to just, okay, be steering right. You can say, it's okay, you're turning in the right direction. Whereas if you steer your steering wheel left, what's going to happen? Your car is going to be steered left. So the same is, okay, pretty much, okay, as the same mechanism is, okay, will happen here. But where it's not going to be, it's okay, your car that's going to be steered in one direction or another direction, but actually it's okay, your beam that is going to be steered. Did that make sense? So pretty much, okay, due to that steering of your beam, that tells you, yes, okay, why you may get the image shape that you get. Yeah. Next point goes. And that's going to be, as okay, what we're going to call is, okay, beam focusing. Because, okay, what we have said ever since is, okay, we start talking about is, okay, a beam. Ever since, yes, okay, we have talked about the beam. We mainly said, okay, there was going to be, yes, okay, the beam that was going to be, yes, okay, responsible for focusing. either at one point or yes, okay, at multiple points. Because what caused the beam to just okay focus at any depth was that okay, yes, that beam actually is okay narrows down. Now if you say it's okay, it just narrows down, okay, yes, this point here, that will be as okay, very focused. But if at the same time we also want the beam to just okay focus at this depth here, and this depth here, and this depth here, that will mainly mean that okay, yes, we will have to cause the beam to just okay get to its narrowest point at this depth, or focus at this shallow depth, this greater depth, and okay, we can say it's okay, this greater depth. Clear? So that's okay. This different focusing is only going to be as okay possible for as okay for our array transducers. Okay. In 4 out of 5, yes, okay, array transducers that we have, this multiple focusing here is going to be as okay electronic. Controlled by as okay the mechanisms, or it's okay by the electronics of your system. Because okay, what we actually have in the system is going to be something that we call a beamer, or it can also be called beamer, or can also be known as the beam former. Where the word beam former actually is okay, Charles, yes, okay, that's going to be as okay the component of your electronics that is going to form the beam. And when you form the beam, you actually as okay say, well, okay, focus at this point here. Focus at this depth here, focus at this depth here, focus at this depth here. Because I want you to just okay produce a beam, yes, okay, or okay, work in a way that okay, yes, the beam gets to its narrowest point at this depth. Or this depth. Or this depth. Or this depth. Technically, what we do is we mainly as okay, just choose the number of focal points and place those focal points as we want to. The rest is going to be as okay up to this beam former here to produce the beams that will be focusing at the focal points that we have chosen or that we wanted to focus at, and that number.
I have a question.
Yeah.
So the beam former, it tells the beam where to focus?
That's made as okay the piece of equipment in the system. That's going to form the beam. Now, when I say it's okay, I'm forming a beam. Let's say I was the beam former. I get a signal or a command from the sonographer. Not a verbal command. A command of, okay, it's the setting and adjustment on the system. Now, if I'm in the beam former, I mean, it's okay, just going to work accordingly and send out and say, okay, you wanted to focus at this point here? Good. I'm forming a beam that focuses at this point. You also want to focus at this point here? Good. Here's a beam. You also want to focus at this point? Okay. Here's a beam. So the practical of okay, yes, ultrasound is very straightforward. Clear? Is the physics part that okay has a little bit of okay has a pain in the behind. Okay. Now this beamer or beamformer, yes, okay, we will talk not really in much detail about it in chapter 14, but it's okay, it will be discussed then. But what we mainly can say is okay, by setting the focal point or multiple focal points, what is it that we are doing? We are sending a message to the beamer or beamformer to form the beams that will, okay, as focus at the depth that we have asked for. Did that make sense? Yesterday, I told you ladies, read on these topics here, right? I gave you, as okay, different things to look at, which was okay, sporadically, as okay, from different chapters. That was pretty much okay, me asking you girls, well, okay, go back and look at those things, focus at those. One topic was in chapter 4, one was in chapter 7, one was in, okay, as chapter 9. What was that me doing? What was me? What is it that I was doing? Mainly as okay, setting different focal points. Now you as a beamer will say, okay, let me go and look at chapter 4, because that was what Mike told us to focus on. Let me go and look at chapter 7 because Mike told us to focus on that as well. Did that make sense? So I was a sonographer and you girls were the beamers. And what did you do? You went and you send a beam, or you just, okay, open the book in chapter 4 and say, okay, let me just look at the PRP and depth. Let me just look at, okay, yes, the anatomy of a beam in chapter 9. Let me just look at, okay, yes, things such as, okay, yes, PCT or active element in chapter 8. Because these were the different focal points that I had told you girls to focus on, or topics. Did that make sense? So the beamer or beamformer is mean is okay, just a piece of electrical component in your system that is going to be responsible for forming the beam. And the two things that your beam is going to be responsible for doing is, first or foremost, focusing. Because where is it that a beam will focus at? At its narrowest point. Where do you find that narrowest point? Well, okay, at the end of the near zone. How do you set the end of the near zone of the focus? By okay, adjusting your system accordingly. You say, okay, I want to focus at a depth of 2 centimeters. Good. You set that as a focal point. For most of our transducers, okay, we will be able to just okay, set multiple focal points. Okay. Now, yes, okay. In that instance, yes, okay. We don't really have to change our transducer because the signals coming from the system actually is okay, will enable us okay, that transducer to produce beams that will focus at more than one point. But how it practically goes is that, okay, yes, first it will focus at the shallow depth, then it goes to the deeper depth, then it goes to the deeper depth. That's how it goes in the system. Okay. But we don't really, as okay, are able to, as okay, detect that, because okay, it happened so rapidly that okay, it says okay, the frame rate of the system is beyond the speed at which okay, yes, your system or your eyes will be able to detect it. So you actually see as okay, an image that is going to be focused at multiple depths because you chose it to do so. Okay, but as okay, when we talk of beam, two factors: focusing, because it's the beam that's going to determine where is okay your focus will be. And some of you will say, then what the hell is a foci? Focus is one. Foci is more than one. So foci is just the plural of focus. Where focus is single. Did that make sense? Whether it is single or multiple, focal is just going to be as okay pertaining to the focus. Where you had one focal point or one focus, or where you focused at multiple points. Focal is just going to be as okay pertaining to that. Did that make sense?
Yes.
Okay, goes. Now, mainly, yes, okay, the last point that we may be referring to, yes, okay, in terms of, yes, okay, each transducer is going to be, yes, okay, we can say, how is the damaged PCT, which we also call active element, which we also call crystal. How is that damaged PCT or crystal or active element is okay going to is okay affect the image?
You said damage or damp?
Damaged. If a PCT is damaged, what does it mean to be damaged? That will not be working, right? Right? So how is that going to just okay affect your image? And that's again, it's okay going to be as okay one of those points where you can make says okay, it's going to be straightforward if you know as okay how the PCTs are arranged in relation to one another. Is that clear? Although yes, okay, in one of yes, okay, the 5 transducers that we may be talking about is going to be yes, okay, the focusing of the beam of the PCT that may yes, okay, affect the picture in okay in a specific way. So yes, okay, girls, these are going to be yes, okay, the 5 major points yes, okay, which are going to be yes, okay, mentioned in yes, okay, each is okay in relation to each transducer. One thing that we are as okay, I may add on to is okay, yes, for what kind of examination do you mainly use what kind of transducer? Okay, so that's not going to be as okay directly mentioned in your book. Okay, but you can mean it says, okay, this transducer is okay, that's going to be okay, the common transducer used for this and this and this and this kind of examination. Clear? Yeah, that's okay. That's all dependent upon is okay what it is you're scanning, or that's okay what region of the body is that you're scanning, and so on. So that's why it's okay, and not only it's okay the shape of the PCT, but actually it's okay the shape and size of the transducer as a whole. That's okay, may make a play an important role. Or we can even say it's okay the shape of the image that it makes. Is that clear? Is that clear, girls? Now, just a couple of terms. That is going to as okay be used. It may be as okay given as okay in your text somewhere, but that's going to be something that we will call as okay the footprint. Yeah. Now, ladies, okay, let me just a second. Let's see if I can get those pictures out. Okay, ladies, look here. You guys can see this picture here?
Yeah.
Clear? And okay, ladies, now whether you realize it or not, or we can mainly say that, okay, yes. This thing here. We can say, okay, that's me, that's okay, where you will just okay, put the gel. And then okay, rub this on, okay, that's whatever area that you are going to be scanning. But what we actually can see that okay, as this area here that is lined with the red. This area here is actually going to be as okay, where we refer to as the footprint of the transducer. Is that clear? Okay. So all this area here. There is your footprint. Okay. Now, ladies. Let's see. We can use, okay, look at this one here. Let's choose one. Can you guys see this other picture now?
Yeah.
Okay, so here is okay, we can mainly say that, okay, now this here. Okay, we may lose it a little bit over here, but it's okay, actually, it's okay, it's going to be. It's okay, curve like this. So that's going to be as okay, the footprint clear of this transducer here. Okay, so that's okay, we can make that's okay, say when we talk of okay, different transducers, that's okay. One thing that we briefly as okay may mention is okay, what the footprint is. But just keep the main as okay, that footprint, because it's okay, the part of the transducer that well, okay, comes in contact with the patients. Oh yeah, because it's okay, skin. So if you have an image, the other day it's okay, I turn on that curved transducer. Or we call it okay, the curvilinear. Oops, sorry. Okay, which means okay, give you this kind of image shape here, mainly because we had this transducer here, where we can mainly see that okay, yes, this here, that was the footprint of this transducer. And where do you see as okay, the area of the transducer's footprint on an image? That's always as way going to be as okay at a shallow depth. So yes, okay, in most instances, not all, but in most instances, yes, okay, the shape of the footprint will help you as okay, describing as okay, the shape of the image. In most instances. Because okay, we had another transducer that we also looked at the other day, which has more or less of a, against this okay, straight footprint. So that mainly means that okay, yes, at least for that transducer, that the image may be like this. Probably not that big, but it can even be like this. Oh, sorry, this has to be more straight. Or it can be like this. But where you again, yes, okay, still will say that okay, yes, whatever we have up here is going to be as okay, the point that's going to be as okay at a shallower depth. Or we can say it's okay, closer to the transducer. Likewise here. This line here will represent the area of the footprint. Or this area is okay, represent okay, at least what we can say is going to be closer to the footprint. Which means it says okay, as you go down and down and down here. That's means okay, just going to be an increasing depth. Likewise here. Increasing and increasing depth. Or likewise here. Greater depth. Greater depth. Okay, girls. So you will hear me as okay using the word footprint again and again and again and again. Did that make sense? So what do we mean by the footprint? Pretty much okay as the area of the transducer that is going to be working in contact with the skin. Or you can say at least okay as where you okay will be applying yes okay the gel. And okay then other side of the gel is going to be yes okay the skin. Did that make sense?
Yes.
Okay. Another term. And ladies, okay, let me just see one thing. That's going to be as okay what we'll call a channel. Okay. Will be as okay what we call a channel. Now, first of all, yes, okay, the channel goals that is going to be mainly as okay relevant to the electronically focusing transducers. Very meaning can say it's okay that it is going to be as okay the transducer that is going to is okay focus electronically. But what is the transducer? Oh, sorry, is the channel. This channel here, not a TV channel or a YouTube channel or something like that. Actually, it's okay, it's going to be as okay equal to as okay three things that will add up together to make up a channel. One is going to be as okay what we'll call as okay the electronic source. Because it's okay the electric source. And you can maybe says okay that's something that's going to be as okay in the system. So pretty much okay as what we have in that big piece of machine. That's where that's going to be as okay different electronic sources. Or what they may are going to do is maybe as okay send out electrical signals. So that's the first component of your channel. Now, as we already also know, that okay, as for an electrical signal to travel, we need a wire. So, okay, that's going to be an electrical wire. And the last component of your channel is mainly going to be as okay with that electrical signal that was produced by the system, which traveled through the wire, is going to be converted into a sound wave. So that's going to be as okay your PCT. Which we as okay also will call as okay the active element. Or we will also as okay refer to as a crystal. But this whole thing here is okay, actually makes up a channel. So what do we have? Electrical source. Electrical source will transmit its electrical signal through wire. And where that wire is going to just okay be attached to a PCT. And what we actually will see is okay, no problem. What we actually will see is that okay, as systems, as okay, when it's okay, our focus is going to be electronically controlled. There are going to be as okay, multiple channels. Or we can say as okay, mainly as okay, one main electrical source, where okay, this electrical source then will okay send out the signals through wires that is going to be attached to multiple PCTs. Okay. As actually as okay, on the journey from yes, okay, from the electrical source through the wire, at some point it's okay, that's going to be as okay, what we may as okay call the beamer or beamformer. Which means yes, okay, will ensure that the signals yes, okay, reaches to the PCTs in a certain pattern. That the beam may be steered in this direction. The beam may be steered in this direction, or the beam may be steered in this direction. And at the same time, also we'll say, well, okay, it was set to as okay, focus at this depth. So what direction the beam is traveling at, or the beams are going to be traveling at, they're going to yes, okay, reach to the narrowest point at this depth. But since there's okay, we may have chosen more than one focal point, then subsequently will say, okay, you also want to focus at this depth. Okay. After that, okay, I set out another set of beam that will focus at this depth here. But all is controlled by the beamer. Yeah.
I have a question.
Yeah.
So after the electrical signal through the wire, it basically sends a message to the beamer before it gets to the PCT.
Exactly. But that's only going to be as okay if your beam is electronically focused or electronically steered. Okay. But what you will see, especially it's okay when it's okay, first thing that we do when we start talking about is okay, this electronical focusing and okay, steering. Okay, the first thing that I may mention again is okay, yes, that's going to yes, okay, be yes, okay, due to yes, okay, the channel. Now, what the blue was a channel. Sorry, what was a channel? That was mean it's okay, it's just a combination of electrical source, which produces an electrical signal. That electrical signal has to travel through an electrical wire. Clear? So here we say wires, okay, it's actually to be more accurate. It's going to be an electrical wire. And that electrical wire means, okay, it just carries the signal, electrical signal from the electrical source to the PCT. And what was the job of the PCT or the crystal or the active element? What was the job of your PCT or crystal or active element? And that will be Dr. Flores Munoz who would tell me that. What was the function of your PCT or active element or crystal?
Can I answer? Okay.
Just hold on here. Yes, Dr. Ana Flores Munoz. If you know it, tell us. If you don't know it, then let me know as well.
I don't remember off the bat, no.
Okay. Dr. King, do you mind tell her?
Doesn't it observe the vibrations?
Okay.
I know it does something else other than like slow down the vibrations.
Does it?
It does. That's all that's coming to me. Can I check my book? Yes.
Maybe Dr. Ramos wants to say something. Do you know what the function of your PCT is? Or
Was it
active
to
element or crystal?
was it to transfer electrical sound into like or electricity into sound? Or
Exactly. When that conversion happens, now I'm becoming a bigger and bigger a-hole. Where that conversion of electrical signal into sound energy happens.
In the
No, not where. We're done with the where. Now the question is when.
Is it before each pulse or like?
No, my dear.
is it like during incidents?
yeah.
Is that what you're
Impedance.
looking for? Impedance, incidents?
No.
Does it happen like when you
Listen. What you said was it converts electrical energy into sound energy, right?
yeah.
That was the job of, okay, as your PCT. But the question then comes, when does that conversion happens?
Is it when it goes through the medium?
What is your medium at this point?
The tissue?
Right.
Well, that's the sound. I haven't got to the tissue yet.
Oh,
Yeah.
oh, I have to go through your transducer first. Before it gets to the medium.
Ladies, that conversion, or maybe I should ask somebody, does Dr. Alexander White wants to tell me? When does the conversion of electrical energy into sound energy happens?
I'm not sure.
Okay. Anybody?
Does it happen like when you turn on the system?
Turn what on?
The transducer to put it on the
Okay,
medium.
this is going to be an interesting discussion now,
It's very interesting.
because I can bet to eat, yes, okay, any crazy thing, yes, okay, swallow this thing here whole. because I told you girls that not just once, at least 5 times, at least. So if anybody can prove me wrong on that one, yes, okay, I'm able to, yes, okay, I'm going to challenge that, okay, I will follow this thing here whole.
Does it go through the mechanical waves?
Is it when it makes contact with like the gel?
Yeah,
Okay, tell us, because you're
When is it that, and that's why I'm very specific, that electrical energy is converted into sound energy when that electrical energy hits the PCT? When?
is it when?
You're not saying where, you're saying when. So is
When?
it the vacuum
The bare
material?
answer is already answered.
Is it the
The bare
matching?
is already answered. That was in the
Yeah.
PCT, right?
Is it,
Yeah.
does it happen in the matching material?
It's not a where. It's a when. OMG. Or who are you believing? Ladies, conversion of the electrical energy into sound energy in a transducer happens during transmission.
Oh, yeah.
So, oh yes. So who is now going to swallow this thing in whole?
No, thank you.
All of you. So what's going to be as, okay, the opposite conversion from sound back into electrical
Reflection.
Reflection.
or during reception, right?
Yeah.
Once that sound energy is received by the transducer, that same PCC will convert that sound energy back into electrical energy so it can be sent through the electrical wire to the system. And okay, as later on become as okay an image. Girlies. You will like, it's okay, you would need to just, okay, start studying. Okay. I don't want to be rude, but it's better than it's okay me being an a-hole now and get you girls on a straight path than okay as on the day of your final, where you look at your test and say, what the f. Okay. So it's okay. Right now it's not too late. So that is during transmission. But where did that conversion happen? In the PCT. Okay. You can make it as okay, any electronic gadget or any gadget that we have that may run on energies in one form will be as okay converting that energy into another form to make it usable for us. Here we don't want to electrocute the patient, so that's why it's okay you would like the energy to be converted from one form into another. If you are not doing ultrasound, boy, it's okay, the electrical chair, you don't really need to convert the energy. Right? So it's okay, that is where, but then comes when. Here. And the when is going to be as okay. Is that conversion during is okay transmission, where the sound wave is being sent out, or is it just okay during reception? when that sound wave reflects back and is being received by the transducer. Because it wasn't electrical wires, because it just carries electrical signals to and from the transducer. Did that make any sense? Okay, girls, but please, 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 there's going to be a term that we will call a channel or refer to as a channel. And what was that channel? It was made as just the an electrical source with an electrical wire that ends up at its PCT. This whole structure here is going to be a channel. And mainly as most of us electronically focused and steer transducers. What goes me is because we will actually end up having multiple PCTs. You can actually say that we will end up having multiple channels. Okay. So that's two terms that I will be using or will be helpful in understanding most of the discussion here. One is going to be the footprint. Clear there, as the footprint, that means there's going to be that part of the transducer that is going to be coming in contact with the patient's skin. Or you can say where you may apply the gel. But the shape of that footprint and as to some extent the size of that footprint may have clinical implementations and so on. And may have an effect upon the shape of the image. And what we mainly will say that then the dimensions. Because here you see the footprint is narrow. So it's Here, this is a greater dimension. That's most likely he will say no, it's this dimension right on here is going to be on your so your image is made is going to be like this. Or it's you can say it's if this was your footprint, yes, you can still have an image in this way or an image in this way. So how we get all those things is from using the same transducer. That's what we also will be discussing. Clear. And then yes, your channel. So the channel is it starts in your system, that big piece of machine. From there it's through the wire to the transducer. Is there anybody who is in doubt about any of this? Okay. It's we. Okay, ladies. Now when we come back, after lunch, we will, yes, okay, briefly just list our transducers that we'll be discussing as we go through this chapter here. But then we will, okay, start checking up each transducer individually. Clear? Now, before getting to that, once you're done with your lunch, please go back to your chapter. Okay, I also got which chapter that is. Chapter 10, I think. Okay. It talks about that. Yes, chapter 10. And look at, okay, yes, page 154 and 155. Please look at those two pages where it talks about focusing. Okay. Did that make sense?
Yes.
Okay. So yes, okay, that may be a little bit helpful so we don't have, yes, okay, the same situation that we just had when we did the VRMN questions. Okay. So should I say that I see you ladies back at 12:55? Okay, take care then. Okay, girls, welcome back. And okay, let's not delay our discussion, but I mean, it's okay, jump to the dish. Okay. So, the kind of transducers that we will be talking about in this chapter here. Now, the first one is going to be okay, what we will call a mechanical transducer. And what you girls mainly will see focus. And the other thing is going to be beam steering. That as far as your mechanical transducer is concerned, the beam focuses are going to be as okay, fixed. And the beam steering is going to be mechanical. And what we already know about is okay being a fixed focus, is that it's going to be one focal point. And it is fixed, which mean that is not going to be changeable or adjustable. Then the other category of transducers that we would have is mainly going to be as okay, what we can call array transducers. And when we say array transducer, what we actually is okay, what we mean by that is that okay, yes, they have the ability to have okay multiple focal points. Is that clear?
Yeah,
And that's mainly as okay what we get from the word array. So whenever you see the word array transducer, there's no question about it. This is going to be as okay a transducer which will enable you to focus at multiple points. Clear? But just because you can do something doesn't necessarily mean that you have to do it. Right? Okay. You sit in a car behind your wheel, you, yes, okay, may be able to, yes, okay, drive 320 miles an hour. Because, okay, that's the speed limit that your car is able to, yes, okay, run at. But just because it's able to do so doesn't necessarily mean that you have to do it. Clear? But okay, what any of these array transducers here is okay, enables you to do is focus not just at one point, but at multiple focal points. And how is it that focusing is going to be determined? That's going to be okay determined by your beam. Now goes in the array transducers. We have a greater array, a variety of array transducers. Now, although it's okay, this one here is mentioned okay as a little bit later in your book. But the first array transducer that I will be talking about with you guys is going to be as okay, what we can call is okay, the annular phased array. Now it's okay, it is an array transducer. I mean, it's because it's an array transducer, it's okay, it's going to have okay, has multiple focal points. But to understand, yes, okay, how this fellow here focuses, that's probably okay, going to be okay. A little bit of your homework that you may have to do is that okay, as you go back to chapter 9. You see, you're not getting out of chapter 9 that easily, right? Okay. But mainly as okay, just read as okay the relationship between diameter of PCT and focal point. Oh no, sorry. Focal depth. That will tell us pretty much okay how this transducer here is going to be focusing. Now, the reason that I okay want to do this one here before it's okay going to the other array transducers is that this one here is okay, is still going to is okay, the beam is still going to be as okay what we can call mechanically steered. Okay. We can also say that okay, as this one here is also going to as okay be as okay. If we can say the only array transducer where the multiple focusing is not electronically controlled. But it is still an array transducer, which mainly mean that okay, it will be able to just okay focus at multiple points. Other array transducer that we'll be talking about is going to be, or we'll call it okay, a linear phased array. So as far as, okay, as the focusing of this one here is concerned, that is wholly and solely as okay electronically. So you can mean it's okay, primary is okay with the function of your channels. It's going to play a role here. Likewise, is it that okay as your beam steering is also going to be as okay electronically steered. Not like the previous two ones where it was going to be mechanically. The next transducer, which is still going to be as okay an array transducer, is going to be called as okay a linear sequential array. Where this again is okay means that okay it has multiple focal points. And how is that going to be done? Again, yes, okay. Electronically. So again, yes, okay. Most likely, yes, okay, with help of your channels. How is the electronic or how is the steering going to be performed? Again, yes, okay, electronically. The next transducer. Now this one here has okay have a couple of names. We can call it curved. Okay, a curved array transducer. Clear. It can also be called as okay the convex array transducer. And it may also be known as the curvilinear array transducer. And I showed you girls that one the other day as well, if you guys remember. That was mainly as okay that transducer that had that curved footprint. Now this one here is okay again, it's okay, your steering of the beam here is going to be electronically. So the focusing is going to be electronically, and so is the steering. Is that clear? Now, yes, okay, ladies, the last of our transducers that we will talk about is going to be as okay, what is known as a vector array. Some people may also, yes, okay, well, this can also be called, yes, okay, or also known as a virtual array. Again, yes, okay, here is okay, the steering. That's yes, okay, the focusing. It's going to be electronic. And so is the steering. It's going to be electronic. Is that clear? So if you look, ladies, everybody says, okay, that the focusing of the beam is going to be electronic. And or the steering of the beam is going to be electronic. Where there is the linear phased array, where there's the linear sequential array, where there's the curved array or convex or curvilinear array transducer, or the vector array transducer. That electronic focusing and steering is going to happen by the same mechanisms, whether it's from transducer to transducer to transducer to transducer. Okay, so that's mainly the reason that I want to go in this sequence here is when we talk about our transducers, because before even starting with, we can say the linear phased and or the curve linear sequential or the curvilinear or vector array. I mean is just give you ladies as a detail account upon us. How is it that any of these transducers will electronically focus and or is electronically steer the beam? Otherwise it's going to be the same mechanism for this. And this. So you can make say we kill 4 birds with 1 stone. We talk about it once and it's done for the rest. Does that make sense? So mainly as just major as a matter of copy and paste. Hey ladies. So who read on the focusing that I asked you guys to do? Chapter 10. Did anybody even bother? Okay. Let's see what that leads to. Hey girls. So our first transducer is going to be the mechanical transducer. Clear? Now this may also be referred to as as to the fixed transducer. And some people may even call it the conventional transducer. So these are all just different names Oh, yes, okay, or is referred to as in your heading of the book as the mechanical transducer. But the reason that we call it is okay, it's also known as a fixed transducer because it has one fixed focal point. Which means okay, focuses conventionally, which we also saw in chapter 10 on the topic of focusing. No. I will. So first thing first, number of PCTs for this transducer here is nothing but just one PCT. So this transducer here only got one single PCT. It's not going to have 2, it's not going to have 3, it's not going to have 4. It just got one PCT. And ladies, that PCT is mainly going to be circular in shape. Or we can actually, just shaped like a coin. Did that make sense?
Yeah.
So if you guys want to know what the PCT looks like in this transducer here, just look at a coin. Okay, my wallet is too far away from me, but okay. If anybody, let me just get a coin. Just a second. Yes. Yes, girls. Here we go. This is a coin, right? Now, when I hold up the coin like this, you can mean it says, okay, this would be the height. And okay, yes, from here to here. That's the width. Clear? And this coin hasn't been passed through, yes, okay, one of those machines that they have at different, yes, okay, amusement parks and so on. So where you can make a coin for that amusement park. Okay, if somebody else, okay, wants to, yes, okay, destroy a penny, they may have to, yes, okay, pay 75 cents to do that. And okay, as they get, okay, yes, okay, yes, you were at Chuck E. Cheese, you were at, okay, as Hershey's Park, you were here, you were there. Clear? But girls, what is this dimension here going to be? Sorry. What do you call this dimension of the coin? Anybody? Because this was the height. This was the width. Now, what is this dimension here?
The length,
Huh?
the length,
Yep.
No.
can it be Z? Is it Z axis? If that's the
No.
width, no, it has to be the Y axis.
Is it
Close.
thickness?
Huh?
Thickness?
Bingo. Everybody owes Dr. Astrid Geraldo a quarter when you come back. Ladies, what they say, 3 dimensions. Height, width, but then this becomes the thickness. Okay, so yes, okay, to understand, yes, okay, what this PCT or crystal or active element of, okay, of your mechanical transducer looks like, just look at a coin. And what do we see then? And go, this is going to become handy. So it says, okay, it's circular. Oops. That's the most off circle in the whole world. That we can mainly say is, okay, that this dimension here, which will be as, okay, the width, is going to be equal to this, okay, this dimension here, which is the height. Right? Did that make sense?
Yes.
Okay. So, okay, so we pretty much, okay, yes, as far as the number is concerned, there's no argument about that. Just one single piece of sheet, and it's going to be as, okay, circular shaped, or shaped like a P, yes, okay, a coin. To be as, okay. It's okay, straight. But then you can say it's okay, you may have, okay, as a small coin. So that will be as, okay, a small PCT. You may have a big coin. Or you may have even, yes, okay, a bigger coin, right? Okay, because, okay, you go and say, okay, this was a penny. We have a coin that is bigger in size, which, okay, yes, maybe, yes, okay, let's say, yes, okay, a quarter, right? And then you may have some of those as, okay, crazily big coins, like, okay, have you got to see, yes, okay, those dollar coins that they make? So what would you see then? Okay, yes, if the PCT had a smaller diameter, was, okay, was a smaller PCT, or the transducer had a smaller PCT, that will cause it to, yes, okay, focus at a shallow depth. Where, okay, this will have focusing at a greater depth, and okay, this will have focused at the greatest depth. Provided that, okay, as the frequency for each of these transducers here was the same. Did that make sense? But yes, okay, it is going to be fixed. One of the factors coming in is, okay, BS, okay, how big is the PCT? Did you girls get that?
Yes.
Okay, ladies. The next point here is going to be, yes, okay, the shape of the image. And what is that? What's the image going to be? That's pretty much okay, as what you ladies or anybody, yes, okay, will see on the screen. That you, yes, okay, of your scanning. So what is going to be, yes, okay, the shape of the scan?
I have a quick question.
Yes, my dear.
Sorry. So in the book, so is the mechanical transducers, those are the older kinds, and then the arrays are the newer kinds?
You can put it this way. You probably, or you should never say never, but you most likely won't come across a mechanical transducer.
Okay, so most likely we would be working with the arrays because those are the more modern
All
ones.
of them will be array, yes.
Okay, gotcha.
Clear.
Thank you.
No problem. Unless, okay, as you end up working at a facility where the doctor or is okay, the staff who worked there is okay, inherited a transducer from their great grandfather's time. Okay. You probably as okay won't come across as okay a mechanical transducer. Yeah. Now the shape of the image here. Now this is mainly as okay, where actually is okay. Where we will talk as okay, it is going to be this shape here, which is going to be as okay that sector shape. Clear? You may as okay go into the food department and says okay, pizza slice shaped. But what you actually as okay will see, and that's going to be as okay be of importance is that okay as this sector shape here actually is okay fans out. Now when we say fans out, yes, okay, this is not the kind of fans that you get if you are a singer or a celebrity or so on. No, that mainly is okay, just refer to yes, okay, those old day, yes, okay, handheld fans that you can make is okay, spread out. And okay, yes, use as a fan to yes, okay, get okay as a cold breeze of air. What the hell? Is that
So
clear?
So the sector shape fans out, meaning it spreads out.
Exactly. Okay. But okay, now that's okay. Probably not going to be like this, but rather like this. It fans out, and you say, okay, yes, your image goes like this. Yeah, this part here, we can say, it's okay, this point here. Oh, that's okay on your image. That's going to be, it's okay where you have your footprint. Okay, so this fanned out shape of your image is what we actually is okay refer to as okay as being a sector shaped image. Is that clear?
Yes.
Okay, so that's okay. That's pretty much okay as what we mean by a sector shape image. That it has this is okay, standing out appearance, or it's okay, it looks like this pizza slice. Now goals, just keep in mind here, and okay, that's going to become relevant again and again and again. This was just okay, meaning is okay where your transducer was. Now this transducer here is okay, only as okay, we can say it's okay, only had one PCT. But even as okay, for our array transducers, most of them are going to have is okay, most of them are going to have okay, some sort of okay, as sector shaped image. But what we actually that's okay, and even here, because okay, up here at this point here, if you say it's okay, that okay, as this is how it fires out. Let me just okay, do it individually. Sorry. In different colors. Because it's okay, this will be it's okay, the pulses. And what remains is okay, we'll see that okay, as up here or at shallower depths is a greater line density. Why? Because it's okay, the pulses are going to be as okay, more closely packed. Or we can say that that's going to be as okay, a lesser distance between two consecutive pulses compared to as okay as they go deeper. This pulse will go like this. This pulse here is okay, goes like this. This next pulse here is okay, goes like this. And then you go and see it's okay, this last pulse here, for instance, okay, might have gone like this. So what do you see? That as we go deeper and deeper and deeper and deeper, mainly because okay, it fans out. Get this as okay, sector shape image here. That the distance between the scan lines, which we actually is okay, called the pulses, will increase. Did you girls get that? Okay, so yes, okay, at greater and greater and greater depths, what is going to happen? Like this, the line density reduces. All mainly because of the increasing distance between two consecutive pulses. But just if you look at the hands or the fingers of my hand, as I spread them out, you can say, okay, at the fingertips, that's mean is okay, where the distance between finger to finger to finger to finger to fingertip is at the max, right? Okay. And just assume that, okay, this was just, okay, how the pulses were sent out. Whereas, okay, when you look here, the distance is lesser. Now, had I had even longer fingers which will keep on spreading out like this, you can make, okay, just compare that to as, okay, being increasing is okay, the depth of the image. So your question would then be, is okay, what about if we went up here? Yes, okay, then the distance between the fingers would have been greater and greater and greater because they would have been fanning out more and more and more. And I only had 4 fingers to deal with, right? Okay. Did that make sense? Okay. So girls, this is going to just okay become a question later on. Because okay, what we will see is that there's going to be okay some space that needs to be filled up. All this empty space where there is no pulse. But what we mainly can say is okay, at areas like this, yes, okay, that's where we will have okay, as the best spatial resolution. Where okay, as the distance between the pulses increases, or we can say okay, the line density decreases. And okay, as these greater and greater depths says, okay, what's going to happen is that the spatial resolution is going to just okay. Great. Did that make sense?
Yeah.
If it doesn't if it doesn't do it now, it's okay. But it's okay. We'll talk more about it's okay, things like this in a following chapter.
Okay.
Yep. Okay, girls. Now, in this transducer here, it's okay, we only got 1 PCT. Yeah. So just think of as okay, 1 PCT is okay, being is okay, like this. Now, wherever I am looking at, or whichever direction is it that I'm looking at, that's going to be okay, the direction in which the beam will be steered. So right now, yes, okay, I'll be steering straight. Or if I was a PCT or my face was a PCT that produced a beam right now, since I'm looking straight, that beam will yes, okay, mean yes, okay, be steering straight. But that's not what we call steering. That's me, yes, okay, just going to be yes, okay, stagnant or stationary beam. Steering mainly means that okay, the beam goes like this from side to side. Just like okay, as I said, yes, okay, when you steer your car to right, you do so by okay, turning your steering wheel, and that's how it will go. Your car will go like this. Or left. So the question then comes, okay, since we only got 1 PCT contrary to yes, okay, most of our array transducers, which will have multiple PCTs. Okay, where the steering is going to be as okay, electronically. Here, yes, okay, the steering is going to be what we call mechanical. Because there is only 1 PCT. And okay, yes, it means yes, okay, will just only and only as okay be sending pulses out in the direction, or we can say okay, the beam out in the direction that it is looking at, or is facing towards. So right now here is okay, or me is okay, just had beam steering straight. The question is, okay, how do we, for instance, okay, make the beam? Because it's okay, we steer in this direction. That's may going to happen, yes, okay, if the PCT physically, or we can actually say, okay, mechanically is going to, yes, okay, be steered in this direction or moved in this direction. So the actual PCT will actually, it's okay, physically move up like this. And only then is it that, okay, yes, that when it is here, it's going to, okay, send out pulses or beam in this direction. When it is here, it's going to be sending out like this. When it is here, it's going to be sending out like this. Or yes, okay, the other way around. That okay, if it's here, it's going to be sending out the pulse like this, or the beam like this. When it physically moves like this, is up here, it's going to be sending out like this and like this. So what actually happens, girls, is that the PCT or the crystal is going to, yes, okay, physically, yes, okay, be moving. Trang, 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 trang. Or mainly as okay, like this. From side to side. Did that make sense?
And that happens with the mechanical transducer? Or no,
Exactly.
that's not. Okay.
That's the mechanical transducer. That's how. And that's why I said, in this case, yes, okay, the steering is going to be mechanical. Clear? Because it's okay. Or we may, yes, okay, call it mechanical because it's going to be, yes, okay, something is okay that physically is okay moves. Right. Otherwise, ladies, had it not been able to steer, then okay, yes, we could mean it says okay, it would just be as okay, looking in one region. And okay, then you will not have had that sector shaped image. Because okay, for the sector shaped image to form, you will have it's okay, the PCT has to just okay be able to just okay be steered in this direction. And all is okay, the PCT will have to just okay be able to get steered in this direction here. Which is mainly going to happen as it physically moves. I mean, it's okay because it requires okay this physical movement of the PCT back and forth, just like a pendulum. That's why we say, okay, it's that the way or the mechanism by which the beam is going to be steered is mechanical. Did that make sense?
Yes.
So right now, it's okay, if I'm looking straight, this would be as okay where the beam was. Now there may be somebody as okay behind me who is pulling the strings. And say, Mike, look right. Okay, straight out again, look left. Whatever was pulling the strings here was okay as the mechanisms. So this kind of steering is okay, where I physically have to move my head from side to side, physically, to cause steering is going to be as okay how this transducer here steers. Okay, not you moving the transducer physically. No, but actually it's okay within the transducer, like the PCT, which is just one single piece of a crystal, is going to physically move from side to side. And in that way, it's okay, steer the beam. Just like the wipers on your windshield. And strange enough, you see as okay if you only as okay use one wiper on your windshield. Sorry. This is where your wiper finds the walls, right? Okay. Well, it's okay if it goes, let's say it's okay. When the wiper goes here, then okay, yes, I guess it's okay. When it is straight out, and then it's okay when it goes this way here. Did that make sense? So just like, okay, I said, your wiper is okay, physically move from side to side, side to side. Likewise, is it that okay, as the PCT is going, she is okay, move. I mean, it's okay, due to the string, it's okay, that's how it's okay, although it's just one PCT, but we still get this sector shaped image. Did you girls get that? Did you girls get that?
Yes.
Good. If not, well, okay, unless it goes in range, that's okay, but just splash something on, okay, it's on your windshield, on your car, and okay, just turn on the wiper. Or just turn on one wiper. Psst, psst. Now focusing. Now again goes, as I say, it's okay, focusing. That would mean it's okay, going to is okay, B is okay, a function of the beam. Because we said any point at which is okay, the beam is at its narrowest, that's going to be it's okay, the focus. Now, ladies, for this transducer here, we said, okay, as this focusing was fixed, which mean, okay, it only had one focal point. It mean we can only focus at one point. And just to make that worse, that focal point is fixed. Which means okay, even if we wanted to, we couldn't we were not going to be able to focus at a shallower depth or at a deeper depth. Did you ladies get that? So it's okay, for this case, okay, this was impossible for this transducer to focus at, okay, as this at this point here. Because as the way that, okay, the transducer was made, it only had, okay, as one fixed focal point, which was this one here. Now goes, if you guys remember, yes, okay, and again, yes, okay, and that's why I asked you guys, yes, okay, go to chapter 10 and look at focusing. Because, okay, in fixed focusing, what did we have? We mainly had, okay, as two possible mechanisms, right? We had what we called external focusing. What was that in what did we have when we said external focusing? That there actually is okay was a lens in front of your PCT or curved lens. And what that curved lens actually was going to do, or maybe that's okay, going to cause that, okay, yes, whatever sound waves were produced by the PCT. Once they hit that curved lens, that's okay, will start refracting. I mean, that's okay, cause that, okay, as those, well, that's okay, that the beam instead of, okay, traveling in straight lines, actually, that's okay, will start to, is okay, converge. And okay, this will cause the beam to focus at a point. But that was what we call external focus, which is fixed. Did that make sense? So either can it be by external focusing, which is this mechanism here, that causes us, okay, the beam to focus at, okay, as that fixed focal point. Or we could say that, okay, as this fixed focal point here is okay, or focusing off the beam of what we call internal focus, which is still fixed. Now, what was the mechanism of, okay, as an internally focused fixed beam? Not that we had, okay, as a curved lens in front of the PCT that was going to just, okay, cause the beam to converge in the near zone. But actually, that's okay, the PCT itself has this curved surface. So as the sound rays were just, okay, produced by the PCT, but they hit that curved surface, they will start to just, okay, converge. And okay, yes, we mean, okay, yes, the beam, yes, okay, will focus at a fixed point. Clear? So why are these focal points here fixed? Mainly because it is the hardware of the transducer that sets that. So in fixed focusing, it can be either external focusing, which is this, or it could be as okay, internal focusing, which is this mechanism here. But that is fixed. Which mainly mean that, okay, now some of you guys, okay, may then go, okay, let's say that, okay, this was the focal point. This was the focal point, but it's going to be the focal point is okay when it's okay, the beam was steered straight. But when it goes like this, the beam will be focusing at this depth. Or it's okay when it goes like this, we'll focus at this level. So it's okay throughout, as okay, this area here of your image is going to be as okay where the beam will be focused at. But it is fixed. You can't focus at a shallower depth. You can't increase the focal depth to deeper depths. Forget about it, okay, have more than one. Did that make sense?
I have a question.
Yeah,
So you said you can't focus at a shallowest depth? What
I
did you
didn't
just
say
say?
that. That's not what I said. Well, okay. If this, for instance, here, let's go, let's, okay, when I talk, please look. If this was your focal point here, it is fixed. Why I mean that's okay, due to, yes, okay, we can say it's okay, the hardware of your transducer, the way that it is made. Clear? So since it is a fixed focal point, that's okay, you can't shift your focal point to a shallower depth. Neither can you transfer it to a deeper depth. Did that make sense?
Yes.
Because this transducer that we were using here was made as okay, made just to focus at this depth here, because it's okay, at a depth of, let's say, 3 centimeters. Which means to me it's okay, you will not be able to focus at 2 centimeters, 1 centimeter, half a centimeter or so. Neither for this one here will we be able to focus at 4 centimeters, 5, 6, 7, 8, whatever. This was the depth at which the beam will be focused at. Did that make sense?
Yes.
So you can't change the focal depth or focal point because that's fixed. Now, ladies, last question is, what if you have, yes, okay, a damaged PCT? What's going to happen? Or what's going to be, yes, okay, you can say it's okay, the effect on the image.
No image or like a damaged image.
There will be no image at all. And just think of it that way, because, okay, that PCT, that's mainly as, okay, what the transducer needed to create what was going to just, okay, produce the image, which was sound waves, right? If that is damaged due to one or another reason, and you only got one piece, well, okay, yes, the thing that was going to just, okay, enable the transducer to just, okay, produce whatever form an image, or help the system to create an image is damaged, then, okay, yes, you really don't have it. So there's going to be, okay, a total loss of image. Just like go ladies, you guys see this bulb here in the background? Let's say that, okay, that was my only source of light in this room that I'm sitting in. This bulb here is okay, yes, okay, get fused or whatsoever. Or the bulb may is okay, I go dang. That happens, right? And then you have to change your bulbs. But says, okay, since this was the only source of light that I had in my room down here, for instance, I may turn the machine on. I may try to turn my light on from the switch. But since it's okay, this bulb here is gone. Bye-bye, gone by the wind. Would I get any light? No. So just one, yes, okay, source of light. Well, okay, yes, if that is damaged, no light. Likewise here, the PCT mainly is okay, the component of the transducer was going to just okay, enable that transducer to produce what is needed to make up an image. And if that is done, gone. It doesn't really matter whether it's steering this way, this way, this way, this way, whatever. You have no image. Did that make sense? Clear? Okay, so this is going to be as okay, we can say it's okay, the only transducer where okay, as damaged PCT will lead to complete loss of image. Complete blackout. Okay, girls. Now this is just one page, so please, that's okay, make sure that you read on this transducer here. Okay. Another thing, my ladies, is going to be as okay for your annular array transducer. Go back to chapter 9 and look at the chapter 10, sorry. No, chapter 9. Yeah, chapter 9. Look at okay as the relationship between focal depth and PCT diameter. Because that's going to become handy tomorrow, is okay, when we talk about our annular phase array transducer. Okay, girls? So besides, okay, reading on, okay, yes, your mechanical transducer, please go back and read that relationship between focal depth and PCT diameter. Is that a deal?
Yes.
Good. So I guess I see you ladies tomorrow at 9 o'clock. Okay,
Okay, thank you.
you're welcome. Stay blessed. Take care.
Thank you.
You're welcome, yeah.